Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Good afternoon once again. We often think of it as a cosmetic procedure, but many people have medical conditions that influence the upper eyelids and can make them sag. So if you do need a procedure to lift your eyelids, or it's been recommended by your doctor, Dr. Jon Mendelsohn joining us now from the Advanced Cosmetic Surgery and Laser Center. I know you have a model there who's had her eyelids fixed. Dr. Jon, what should we be looking for in a procedure like this?
Well, a couple of things. You talked about medical versus functional, or medical functional blepharoplasty versus cosmetic. We see a lot of patients who have a lot of hooding. As we age, we lose volume and elasticity in our eyelids, and so sometimes it affects your visual fields. In those situations, insurance may cover it. One of the things we've discovered, however, is that patients who undergo that medical blepharoplasty commonly end up in our office because they see that they look better now, but they want to look even more refreshed. And so this is simply one of the best procedures I think anybody can have performed in their lifetime. So whether or not you're having visual field problems, or whether or not you're spending a lot of time on Zoom or taking selfies, this is a 20 to 30-minute procedure performed under local anesthesia with 20 years of results.
And we have just a little surgery video from you. Just tell me a little bit, what is it that you actually do in this procedure?
Yeah, so in the video there, what we're doing is we're measuring and marking very carefully the amount of redundant skin in the upper eyelid. And very simply then, we localize it. We numb it up just like you would a little mole or a little skin tag. After that, we excise, we remove the skin. Sometimes there's a little fatty tissue that we need to remove as well. And then we use one stitch, one suture that goes back and forth underneath the skin, and it remains there for about a week while the patient is recovering. Most patients can return to normal function virtually the next day. Of course, there's a little bit of bruising and some swelling, but patients do remarkably well with this.
And on your model, you've done both of her eyelids. Can you point out what you did for us?
Yeah, so I don't know if you've got her before and after, but there's an incision here where we remove the redundant skin, some of the extra skin from her eyelid on both sides, of course. This wasn't for a medical reason, but needless to say, there are patients who come in whose worlds look brighter. Sometimes they're actually getting more light back to their retina following these procedures as well.
Excellent.
Yeah, and you can see there on the left side was her before.
Befores and afters. Yes, we are looking at those, and then we have a couple others to show you, because you can do this a number of different ways. Roughly, this procedure costs how much, and it lasts how long?
Yeah, so probably in the range of $4,000 to $6,000. How long does it last? We always say, you know, we've got 20 minutes will make you look at least 10 years younger. We tell patients this procedure will last 15 to 20 years pretty easily, though.
All right, nice work. Nice to see her pictures, and you look great. If you do want more information, you can reach out to the team at the Advanced Cosmetic Surgery and Laser Center, 513-351-3223. Dr. Jon, thank you for your brave patient. We appreciate you talking about this.
Okay, thank you, Liz. Have a good day.
Great to have you. All right, just ahead.